The topic of discussion in this session is the detailed anatomy of the spinal nerves. Spinal nerves belong to the peripheral nervous system, and these peripheral nerves carry impulses between the spinal cord and various parts of the body. The spinal nerves spring from the spinal cord and are transmitted through the intervertebral foramen. And there are 31 pairs of spinal nerves, in which 8 are cervical, 12 are thoracic, 5 are lumbar, 5 are sacral, and 1 coccygeal nerve. The first cervical nerve emerges from the vertebral canal between the occipital bone and the atlas. It is therefore called as suboccipital nerve. And the 8th one emerges between the 7th cervical and the 1st thoracic vertebrae. So if you see a peripheral nerve anatomy, the peripheral nerve consists of epineurium, which is the outer layer, and it becomes continuous with the dura mater. And the next one is the perineurium. The perineurium layer surrounding a fascicle, and a fascicle is a bundle of axons. And at last is the endoneurium, is a layer surrounding a single axon. Now if you see the gross anatomy of the typical spinal nerve, it has the ventral root, dorsal root, formation of the spinal nerves with this, and also the branches. Now let us talk about nerve roots. Each spinal nerve branches into 2 roots, anterior or ventral, a posterior or dorsal root. An anterior or ventral root emerges from the anterior surface of the medulla spinalis, which is also called as spinal cord, as the number of rootlets. And these number of rootlets which come together to form the bundles near the intervertebral foramen. These fibers supply skeletal muscles and also surrounding structures. Anterior roots contains bundles of efferent fibers. Efferent fibers are nothing but called as motor fibers. Next is the posterior or dorsal root. The posterior or dorsal root carries sensory fibers via dorsal root, and it enters the spinal cord by dorsal root. Its cell bodies are present in the spinal ganglion, and this spinal ganglion are formed outside the spinal cord. And this dorsal root is always larger than the anterior root, and it contains bundles of efferent fibers. Efferent fibers are called as sensory fibers. So here each nerve is attached to the spinal cord, that is medulla spinalis, by 2 roots. Now let us see the formation of the spinal nerves. The dorsal and the ventral nerve roots join to form a trunk of the spinal nerve. So both the sensory and motor fibers are present within the trunk of the spinal nerve. One important point what you need to remember over here, that the trunk of the spinal nerve have both sensory and motor fibers. Next is the peripheral distribution of the spinal nerves. So it has totally 4 branches of spinal nerves: white ramus, grey ramus. So white and grey ramus are collectively called rami communicants, and next is dorsal ramus and the ventral ramus. The dorsal ramus supplies posterior 1/3 of the body wall, and they do not supply the limbs. And the ventral ramus supplies anterior 2/3 of the body wall, including the limbs. And if you see the division, after emerging from the intervertebral foramen, each spinal nerve gives off a small meningeal branch. This small meningeal branch, which re-enters the vertebral canal through the intervertebral foramen and supplies the vertebra and the ligaments and also the blood vessels of the spinal cord and its membranes. the spinal nerve then splits into posterior or dorsal and the anterior or the ventral division, each receiving fibers from both the nerve roots. So here, both of the rami contain mixed fibers. They are motor as well as sensory fibers. Next, about posterior divisions, which is also called as dorsal rami. The posterior divisions are smaller than the anterior. They are directed backwards, and with the exceptions of those of the first cervical, the fourth and the fifth sacral and the coccygeal nerve, they divide into medial and lateral branches to supply the muscles and skin of the posterior aspect of the trunk. And next is about cervical dorsal rami. The dorsal rami of the cervical nerves, with the exception of C1, divide into medial and lateral branch, both of which innervate the muscles. The dorsal ramus of the C1 nerve is also known as suboccipital nerve. It is larger than the ventral ramus and may occasionally be absent in some individuals. The suboccipital nerve supplies the muscles of the suboccipital triangle and the semispinalis capitis. The posterior division of the first cervical or suboccipital nerve is larger than the anterior division, and it is very important point to be noted. And sometimes it has a cutaneous branch that joins the greater or lesser occipital nerves. Next is the C2 dorsal rami. The C2 dorsal ramus gives a large medial branch and the small lateral branch of the greater occipital nerves. And the greater occipital nerve supplies the skin of the back of the scalp as far as the vertex of the skull, and the lateral branch supplies muscles. And next is the C3 dorsal ramus. So the C3 dorsal ramus has a superficial medial branch, also known as the third occipital nerve, which innervates the skin of the lower occipital region, and deep lateral branch that enter the multifidus muscle. And the posterior division of the lower 5 cervical nerves divide into medial as well as lateral branches, and the medial branches of the fourth and fifth runs between semispinalis cervicis and capitis, and having reached the spinous process, spears the splenius and trapezius to end in the skin. Those of the lower 3 cervical nerves are smaller and end in the semispinalis cervicis and also capitis and multifidus and interspinalis. And the lateral branches of the lower 5 nerves supplies iliocostalus cervicis, longismus cervicis and longismus capitis. So this is what you need to know about the cervical ramus. And next is about the thoracic nerves. The medial branches of the posterior divisions of the upper 6 thoracic nerves runs between semispinalis dorsi and multifidus. Then they pierce the rhomboidae and trapezius and reach the skin by the sides of the spinous process. The medial branches of the lower 6 are distributed chiefly to the multifidus and longismus dorsi, and occasionally they give off filaments to the skin near the midline. And if you see the lateral branches, these lateral branches, they run beneath the longismus dorsi to the interval between it and the iliocostalus and supplies these muscles. So the lower 5 or 6 also gives off various cutaneous branches which pierce the serratus posterior, inferior and latissimus dorsi in a line with the angle of the ribs. The lateral branch of the 12th thoracic passes downwards to the skin of the buttocks after sending a filament along the iliac crest. So this is what you need to know about the anatomy of the thoracic nerves. And next is about the lumbar nerves. It has 2 branches, one is medial and another one is lateral. the medial branches of the posterior divisions of the lumbar nerve runs close to the articular processes of the vertebra and end in the multifidus. The lateral branches supplies the sacrospinalis, and the upper three gives off cutaneous nerves which pierce the aponeurosis of the latissimus dorsi at the lateral border of the sacrospinalis and descend across the posterior part of the iliac crest to the skin of the buttocks. So, after the lumbar nerves, next are the sacral nerves. The posterior divisions of the sacral nerves, or we can say the posterior rami, are small. They emerge except the last through the posterior sacral foramina. The upper three are covered at their points of exit by the multifidus, and they divide into medial as well as lateral branches. And the medial branches are small and end in the multifidus. And lateral branches of the posterior divisions of the first lumbar and fourth sacral to form loops on the dorsal surface of the sacrum. From these loops, branches run to the dorsal surface of the sacrotuberous ligament and form a second series of loops under the gluteus maximus. And next is about the coccygeal nerve. The posterior division of the coccygeal nerve does not divide into medial as well as lateral branch, but receives a communicating branch from the last sacral. It is distributed to the skin over the back of the coccyx. Now let us talk about anterior division or the ventral ramus. The ventral ramus and its branches supply motor as well as sensory nerve fibers to the anterior and lateral regions of the trunk and to the upper and lower limbs. The ventral rami is larger than the dorsal rami. Whenever the ventral rami of the cervical nerves unite, they form cervical plexus. In the same way, the lumbar nerves unite to form lumbar plexus and the sacral plexus respectively. And now let us talk about the cervical nerves. So the anterior divisions of the upper four cervical nerves unite to form cervical plexus, and each receives a grey rami communicans from the superior cervical ganglion of the sympathetic trunk, and those of the lower four cervical together with the greater part of the first thoracic forms the brachial plexus. An important question over here is the nerve plexus are formed by the ventral rami only. And totally there are 4 nerve plexus in our body: cervical plexus, brachial plexus, lumbar plexus and the sacral plexus. Sometimes the lumbar and sacral are combined to form lumbosacral plexus. Now, these cervical plexus are formed by C1 to C5, and it consists of cutaneous and muscular branches. Cutaneous branch innervate head, neck and chest, and the muscular branch innervates the muscles omohyoid, sternohyoid, geniohyoid, thyrohyoid, sternothyroid, scalene muscles, sternocleidomastoid, levator scapulae and trapezius. And next is about the lumbar plexus. These plexus lies within the iliopsoas muscle and formed by the ventral ramus of L1 and L4. The main branches innervate the anterior compartment of the thigh, and the smaller branches innervates some of the muscles of anterior abdominal wall and also iliopsoas muscle. And the important nerves from the lumbar plexus are the femoral nerve, which innervates quadriceps femoris and skin overlying it. Next is the obturator nerve, which innervates the adductor muscles and also overlying skin. And after the lumbar plexus, the next one is the sacral plexus. The sacral plexus lies caudal to the lumbar plexus and from L4 to S4, and it is often referred together with the lumbar plexus as the lumbosacral plexus. These branches innervates buttocks, pelvis, perineum and the lower limb except for the anterior and medial compartment of the thigh. The important nerves over here are the sciatic nerve, tibial nerve, common fibular nerve, etc. If you see sciatic nerve, it is the largest nerve of the sacral plexus and it actually two nerves wrapped in one sheet. One is the tibial nerve, which innervates the posterior thigh, posterior leg and intrinsic muscles of the foot. And another component is the common fibular nerve, which is also called as the peroneal nerve, which innervates the muscles of the anterolateral compartment of the leg. So this is what you need to know about the spinal nerves and its segments.